Welcome back to Houston Life. When you first think of bunions, you might assume that they're a problem that elderly women develop after years of squeezing their feet into narrow high heels. However, the reality is that bunions are an extremely common condition. Nearly 1 in 4 individuals in the Houston area suffers from the deformity, regardless of gender, shoe choice, or lifestyle. Makes me feel a little bit better. You guys have absolutely heard me complain about mine many times, which is why I'm thrilled to have Dr. Thomas Pignetti in studio with us today from Advanced Foot Care to chat about a corrective procedure they offer to end discomfort and pain. Dr. Pignetti, welcome.
Thanks so much for having me.
Let me tell you something. I was having a conversation with you about all the conversations we have in studio about my bunions. So I'm so glad that you're here to kind of give everybody the information on what they are. So what is a bunion?
Yeah, so they're, as you mentioned, they're really common, and what someone that has a bunion notices is when they look down at their foot, what they see is kind of a bump that's on the inside of the foot, kind of just behind the big toe. And there might be some redness or pain or stiffness associated with it, but really, as you mentioned, it's a lot more complex than that. Really, what happens with the bunion is it's a complex three-dimensional deformity that occurs when the bones in and around the big toe shift out of place over time. And it's really due to, we have a little model over here, it's really due to a situation where there's an unstable joint in the middle of the foot over here that allows for this long bone, the first metatarsal, to deviate out of place. It tends to move outward, it tends to move upward, and then it even rotates a little bit. And as that happens, the big toe starts to drift over to the big toe, and you end up seeing this kind of this angle or this projection off the side of the foot. But it's really more than just a bump on the side of the foot.
Yes. Okay. Is there anything that you can do to prevent it? Like, can I blame it on me wearing heels? Is it genetic? How did I get mine?
Yeah. So overwhelmingly, it's a common misconception that high heels cause bunions. While high heels are going to crowd the toes together and cause more discomfort, they may even allow bunions to develop sooner or the symptoms to increase faster. But the truth is, it's genetics. Okay. If you've had family members, or if people around your family have had bunions, it's more than likely. There's more than likely chance that you have a potential for developing bunions or have bunions yourself. I'm
going to call her out. She's going to hate me for doing it, but my mom has one too, and we complain about it as we're shopping for shoes. It's very painful. I love to run, I love to exercise, and it actually creates more pain in my foot every single time. But you at Advanced Foot Care, you have a solution for it, a correction. Yeah.
So there's the first thing that typically patients need to do when they see a medical professional for it, and that's what they should do, because you can only get so far on Google getting the information that you need. There's all different types of bunion shapes and sizes. Some have arthritis, some don't. It's important to get it properly evaluated. And what we typically do at Advanced Foot Care up in the Woodlands is we will do a full examination following a history where we kind of find out, how is the bunion bothering you? How long has it been present? Does it seem to be getting worse? What are the symptoms that are associated with it? And we'll do an examination, evaluate the joint, see how things move, and take x-rays that show structurally underneath the skin what's going on with the bones and joints.
Okay.
And once we have that information, then we can start to kind of formulate a treatment plan. And we'll typically recommend some things that are non-surgical or conservative in nature. Usually it's geared towards relieving symptoms and accommodating the bunion, so to speak. So that might be selecting certain types of shoes, anti-inflammatory medications, arch supports to try to control the motion. But ultimately, if that doesn't work, or if patients have already tried that before they've come in to see us, we will recommend a surgical procedure.
Okay, and that one is called Lapiplasty 3D bunion correction.
Yes,
correct?
It is definitely a mouthful. Lapiplasty 3D bunion correction.
Tell us how this works. Yeah, we're looking right here how it works.
So basically, what happens is with the Lapiplasty procedure, there's that complex three-dimensional deformity that you could see there. And what will happen is that there's this unstable joint towards the middle of the foot, towards the arch, and we use special instrumentation to shift the bone into its proper anatomical position. And then once we have things lined up properly, we're going to use a device that's going to realign the bunion deformity by changing the structure at the joint that's actually the root cause of the problem, something called the metatarsal cuneiform joint.
Okay, here's my question. Is this a permanent fix? Once you have this procedure done and nothing else has seemed to have worked, will this give you a permanent fix for your bunion?
So it's difficult to always say permanent, but the studies have shown that the Lapiplasty procedure over time, in studies that reach out to 13 or 17 months, have shown a 98% maintenance of the three-dimensional correction from the bunion procedure. Because we're addressing the root cause of the problem, that unstable joint in the middle of the foot, the likelihood of recurrence drops way down.
Now, should you do both feet at the same time if you have two bunions?
Yeah. Overwhelmingly, we recommend that the procedures be staged. The recovery for the surgery is important to be performed properly so that everything heals the way we intended to. And it's really hard to do work on both feet without compensating off of one and making it more difficult on the other. So we prefer to stage the procedures apart. If everything is going really, really smoothly, we may stage them as close as 2 months apart from one another.
Okay, one question, personal question. Does it hurt?
So we've come a long way in terms of managing pain or discomfort following surgery. Now, different patients' experiences can vary. Different surgeons have different protocols or methods that they use to monitor or address postoperative pain. And we found that in our practice at Advanced Foot Care, the vast majority of our patients do quite well on a combination of over-the-counter medications, typically anti-inflammatories and some Tylenol. We do provide some additional prescription medication should it be needed, but we find that in most cases when patients follow their directions, that they don't really need to dip into those stronger medications.
Okay, if you've got a husband, you can just send him to go get all the stuff that you need.
Absolutely, absolutely. We counsel husbands well before the surgery to make sure that they know what their duties are.
Fantastic. Dr. Pignetti, thank you so much for all the information. If you'd like to learn more, visit footspecialist.com or give them a call at 281-292-7000. And we'll be right back with more Houston Life.